Today we have a question from Harriet Timberlake of Vista, California. Her question is, my biggest concern and the question I would like to ask is simple. What is the rush? To me, changing the entire system that works for 85% of Americans in an attempt to help the other 15% is ludicrous. The sky is not falling, and common sense needs to be demanded from members of Congress on this issues and all the other issues. Well, Harriet, I couldn't agree with you more. And not only are we changing for 85%, including our seniors, a system and robbing from our seniors $500 billion in the current plan, but we're driving up the cost of health care by a fairly significant amount. They estimate going from 18% of GDP to 21% of GDP. What's interesting is they're using Canada as a model when in fact Canada is half the price we are. I don't mind looking at other countries and taking good ideas, but it's very clear you're right. We need to look for the good ideas, not simply cover people at any expense, including on the backs of our seniors. Our next question comes from Richard Nestor of Temecula, California. His question is, my wife and I are both long-term U.S. Air Force personnel. I am retired and she is 2 years from retirement. I'm concerned that the health care discussion I have heard does not include a single speaker addressing the possible effects of our Health Care for Life contract with our government. What can you say about protection of the plans such as TRICARE? Your Southern California constituents include a very high percentage of military personnel. And Richard's absolutely right. He and his wife have earned a special government-backed retirement, and that retirement is in jeopardy if, in fact, what we're doing is destroying the high-quality hospitals that currently TRICARE recipients go to. It's part of the problem of turning upside down a system that works for most of us. Our next question comes from Charlie Bisbee of San Diego, California. I watched your presentation. As a constituent, I strongly disagree with your position. We, the United States government, have failed for too long. The existing system is fatally broken. A government option is the only thing that can possibly lead to reform. What do we do when we lose a job or our health care insurance ends? Well, Charlie, you're right about one thing. We do have to deal with portability in health care. We have to deal with the pre-existing conditions and conditions that occur while somebody's on one health care plan, allowing them to go to another. These are changes that can be made either at the state or federal level. But you know, one thing that the quote public option isn't dealing with, at least if it's the same as Medicare, is it's not finding creative ways to drive down the real cost, the cost producers in healthcare. Medicare has in fact only reimbursed a portion of its fair share while doing nothing to control rising cost. I think that's the part that the government needs to work on, and we should start with Medicare reform because it is a system that has failed and it is a government option for our seniors. And right now the only proposal is to take $500 billion away from a program that already underfunds our seniors.